Imagine a world where your body's most basic functions were mysteries, where pain was an expected companion, and where the line between healing and harm was perilously thin. What if the most profound moments of a woman's life, like bringing new life into the world, were also the most dangerous? What if the remedies for your ailments were based on whispers and ancient beliefs, rather than on any understanding of how your body truly worked? In the year 1185, this was not just a terrifying thought, it was a daily reality for women everywhere. Number 15, the mystery of the wandering womb, misunderstanding a woman's body. Picture this: you are a young woman in 1185, experiencing strange sensations. Perhaps you feel a tightness in your chest, a sudden wave of dizziness, or a feeling of suffocation. You describe these symptoms to your mother or a village elder, and the immediate response is a worried murmur about your wandering womb. This was not just a quaint saying, it was a deeply held medical belief of the time, rooted in ancient Greek medicine, particularly the writings of Hippocrates. People genuinely believed that a woman's uterus was a free-moving organ, capable of roaming throughout the body. When it moved upwards, it pressed on the chest and throat, causing choking or breathlessness. When it moved downwards, it caused feelings of heaviness or discomfort in the lower belly. This profound misunderstanding of female anatomy was a constant source of fear and often led to dangerous and ineffective treatments. If your womb was believed to be wandering, the proposed solutions were often bizarre. To draw it back to its proper place, foul-smelling substances might be applied to the nose to repel it, while sweet-smelling substances were applied to the groin to entice it back down. Imagine the intense discomfort of having pungent herbs shoved under your nose, perhaps even ammonia-soaked cloths, all while feeling unwell. Conversely, fragrant oils and flowers might be placed near your lower body, hoping to coax the unruly organ back to its supposed home. This belief meant that legitimate medical conditions, from anxiety to epilepsy, from genuine gynecological issues to heart problems, were frequently misdiagnosed as uterine wanderings. A woman suffering from an actual respiratory illness might be subjected to these strange rituals instead of receiving treatment for her lung. A young woman experiencing extreme emotional distress, perhaps from the harsh realities of medieval life, might be told her womb was the cause of her hysteria, a term itself derived from the Greek word for uterus. This deeply flawed understanding of the female body meant that real suffering went unaddressed. Women were not seen as complex individuals with diverse health needs, but as creatures whose ailments often revolved around the supposed mischief of a single, misunderstood organ. Moreover, this misconception fed into a broader narrative that women's bodies were inherently volatile, unstable, and often the root of their physical and mental woes. Dismissed genuine symptoms as mere consequences of a mischievous womb, making it harder for women to be taken seriously when they reported pain or illness. If a woman complained of abdominal pain, it could be dismissed as the womb shifting, rather than investigating for kidney stones, appendicitis, or an infection. This systemic medical blind spot meant that many conditions that are treatable today were left to fester, causing prolonged agony, permanent disability, or even death, all because the fundamental understanding of a woman's physiology was so utterly wrong. Pervasive belief in the wandering womb solidified a medical landscape where women's health was often attributed to fantasy rather than anatomical reality, leaving them vulnerable to suffering without accurate diagnosis or effective care. Number 14, when the mind ailed, misinterpreting despair and madness. Consider the life of a woman in 1185. It was a world shaped by harsh realities: famine, disease, the constant threat of violence, and the burden of demanding physical labor. Many women endured repeated pregnancies, the loss of children, and often lived under strict social and religious expectations. It is no wonder that mental distress, depression, and what we now recognize as postpartum depression were prevalent. Yet in 1185, the concept of mental illness as a medical condition was almost non-existent, particularly for women. Instead, mental ailments were frequently interpreted through a lens of morality, spirituality, or even demonic influence. If a woman experienced profound sadness that lingered, an inability to find joy, or sudden, inexplicable mood swings, she might be seen as melancholic, a state believed to be caused by an imbalance of the bodily humors, particularly black bile. While this was a step towards a physical explanation, the remedies were often ineffective and sometimes harmful. Bleeding, purging, or special diets were prescribed, often exacerbating weakness and leading to further physical decline. Imagine a young mother, exhausted and overwhelmed after childbirth, sinking into a deep despair. Instead of receiving understanding or rest, she might be forced to endure painful treatments intended to balance her humors, or worse, face accusations of moral failing. More severe mental health challenges, such as psychosis or extreme agitated states, were frequently attributed to demonic possession or witchcraft, particularly for women. A woman experiencing hallucinations, delusions, or erratic behavior might be subjected to exorcisms, rituals performed by priests intended to drive out malevolent spirits. These rituals could be terrifying and traumatic, involving chanting, prayers, the application of holy water, or even physical restraint. There was no concept of compassion or understanding for the suffering individual. Instead, the focus was on confronting an external evil force. Imagine the terror of a woman, already disoriented and distressed, being held down while a priest shouts at her, convinced she is housing a demon. This approach not only failed to address the underlying psychological or neurological causes of her distress, but also left her ostracized and vulnerable to further persecution from a fearful community. Postpartum depression, a condition now widely recognized and treated, was an invisible suffering. A woman who, after the immense physical and emotional trauma of childbirth, sank into a profound despair, lost interest in her infant, or exhibited irrational fears, would not be understood as suffering from a chemical imbalance or a trauma response. Instead, she might be viewed as lazy, ungrateful, or even as having been touched by evil. This lack of understanding meant that many mothers struggled in silence, their suffering compounding the already immense challenges of motherhood in the Middle Ages. The complete absence of psychological knowledge or compassionate care for mental distress meant that countless women lived lives of internal torment, their inner turmoil unrecognized and untreated, leaving them isolated and often condemned by their own families and communities for conditions beyond their control. Cries for help, often expressed through symptoms that were physical manifestations of their despair, were tragically misunderstood, sealing their fate to suffer in the shadow. Number 13, the silent suffering of intimate infections. In the year 1185, personal hygiene, as we understand it today, was rudimentary at best. Access to clean water was limited for many, and the concept of washing hands or using specific cleaning agents for the body was not widespread. This lack of sanitary practices, coupled with a complete absence of knowledge about microorganisms and how infections spread, made women particularly vulnerable to intimate infections. Think about the daily routines. Communal bathing was rare, and private washing often involved fetching water from wells or rivers that could be contaminated. Undergarments, if worn, were often made of coarse material and not changed frequently, providing a breeding ground for bacteria. Sexually transmitted infections, though not understood in their modern context, were certainly present. Conditions like gonorrhea, syphilis, though its prevalence and origin in Europe before the late 15th century are debated, other venereal diseases existed, and chlamydia likely caused significant suffering. Without any knowledge of how these diseases spread or how to treat them, women experienced chronic pain, discharge, infertility, and in severe cases, systemic illness. A woman suffering from an agonizing pelvic infection might simply be told she had a foul humor or was cursed. Imagine the pain and shame of a constant discharge, an itching sensation that never ceased, or a burning pain during intimacy, with no explanation or relief. These conditions often went untreated, leading to long-term complications such as blocked fallopian tubes, which caused infertility, or chronic pelvic pain, which would plague a woman for the rest of her life. The unspoken nature of these ailments, due to societal taboos and a complete lack of medical understanding, forced women to endure their suffering in silence, often leading to isolation and despair. Beyond sexually transmitted diseases, everyday intimate infections were a common scourge. Yeast infections, bacterial vaginosis, and urinary tract infections were frequent occurrences. Imagine the constant irritation and discomfort of a yeast infection, or the burning agony of a bladder infection. Without antibiotics or even basic antiseptic washes, these conditions were left to run their course, often leading to severe complications. A urinary tract infection could ascend to the kidneys, leading to kidney failure, a slow and agonizing death. Childbirth itself was a massive portal for infection. Without sterile practices, even minor tears or abrasions during delivery could become severe infections, leading to peritonitis, a deadly inflammation of the abdominal lining. The lack of understanding of the female reproductive system meant that symptoms were often dismissed or attributed to non-medical causes. There was no concept of vaginal flora or pH balance. Douches, if used, might involve harsh or irritating substances, further exacerbating irritation or spreading infection. The sheer lack of effective treatments, coupled with a deep-seated modesty that prevented women from discussing such intimate issues even with healers, created a silent epidemic of suffering. These unseen infections, ranging from annoying discomfort to life-threatening conditions, silently eroded women's health, fertility, and quality of life, all because the medical knowledge required to diagnose and treat them simply did not exist in their world. The pervasive nature of these conditions meant that many women lived with chronic pain and discomfort, their bodies betraying them in ways that were entirely beyond their comprehension or control. Number 12, more than a stomach ache, the unseen dangers of internal illness. Think about how many times in your life you or someone you know has suffered from a common internal ailment, appendicitis, gallstones, kidney stones, or a severe bowel obstruction. Today, these conditions are often diagnosed relatively quickly and treated effectively, often with surgery. In 1185, however, the internal workings of the human body remained largely a mystery to medical practitioners. There was no understanding of internal organs beyond their basic location, and certainly no concept of their intricate functions or the diseases that could afflict them. For women, this meant that critical internal illnesses, which often present with vague or generalized symptoms, went undiagnosed and untreated, leading to agonizing deaths. Imagine a woman in her prime, perhaps a farmer's wife or a merchant's daughter, suddenly gripped by severe abdominal pain. It might start as a dull ache, then intensify, accompanied by fever and nausea. Today, a doctor might suspect appendicitis. In 1185, however, this acute condition would likely be attributed to an imbalance of humors, a bad diet, or even a chill. Treatments would involve purges, bloodletting, or herbal concoctions designed to rebalance the body, none of which would address the inflamed appendix. As the appendix burst, leading to peritonitis, a life-threatening infection of the abdominal cavity, the woman would descend into agonizing pain, fever, and eventual organ failure. There was no surgical intervention available to drain the infection or remove the diseased organ. Her death would be slow and torturous, a mystery to her family and to the healers who tried in vain to offer comfort. Gallstones and kidney stones were equally devastating. Imagine the excruciating pain of a stone moving through a bile duct or a ureter. This pain, often described as colicky and intense, would be unbearable. Without diagnostic tools like ultrasound or X-rays, the cause of the pain would be unknown. Healers might try hot compresses, herbal teas, or prayers, but the underlying issue of a physical blockage remained. The stones could cause severe inflammation, infection, and eventually organ damage or rupture. A woman suffering from a kidney stone could develop a raging kidney infection, leading to sepsis and death. Pain would be relentless, with no strong painkillers available to offer relief. Bowel obstructions caused by conditions like hernias, tumors, or adhesions from previous abdominal events, such as difficult childbirth, were also fatal. Imagine the swelling, the vomiting of fecal matter, and the agonizing abdominal cramps. These symptoms, which would immediately prompt emergency surgery today, were met with helplessness. Healers might attempt enemas or strong laxatives, but these would be ineffective against a complete blockage. Bowel would eventually rupture, spilling its contents into the abdominal cavity and causing fatal peritonitis. The suffering would be prolonged and agonizing, a true testament to the limitations of medical understanding in that era. Countless women, these internal afflictions remained silent killers, their precise nature entirely unknown, their symptoms merely misinterpreted as a general sickness of the gut, leaving them to perish from conditions that are now considered routine medical emergencies. Their internal battles were waged and lost in complete darkness, without the light of anatomical knowledge or surgical skill to guide any chance of survival. Number 11, bleeding and pain, the unexplained agony of menstruation. For every woman in 1185, menstruation was a monthly reality, but it was also shrouded in mystery, misconception, and often profound discomfort. There was no scientific understanding of the menstrual cycle, ovulation, or hormonal changes. Instead, menstruation was often viewed as a purging process, a way for the female body to rid itself of excess humors or impurities. While this interpretation acknowledged a natural bodily function, it also led to beliefs that women were inherently more susceptible to illness if this purge was somehow disrupted. This lack of accurate knowledge meant that many common menstrual disorders, which caused immense suffering, went unrecognized and untreated. Imagine a young woman experiencing dysmenorrhea or intensely painful periods. For her, the monthly flow might bring agonizing cramps that doubled her over, rendering her unable to work or even move. This pain, which we now understand can be caused by excessive prostaglandin production or underlying conditions like endometriosis, would have been simply accepted as a woman's lot. There were no effective painkillers beyond weak herbal remedies, and certainly no diagnosis for conditions that caused such severe discomfort. A woman might be told to drink specific teas, apply hot stones to her belly, or even pray for relief, but the fundamental pain would persist, month after month, year after year. Her suffering was normalized, an expected part of female existence, making it difficult for her to seek or receive any form of meaningful intervention. Heavy menstrual bleeding, or menorrhagia, was another debilitating condition. Imagine losing so much blood each month that you became constantly weak, dizzy, and pale. This heavy bleeding, which could be caused by conditions like uterine fibroids, hormonal imbalances, or clotting disorders, would often lead to severe anemia. A woman suffering from chronic anemia would be perpetually exhausted, struggling to perform her daily chores, susceptible to infections, and less able to recover from other illnesses or childbirth. There was no understanding of iron deficiency, no dietary advice to combat it, and no way to diagnose the underlying causes of the heavy bleeding. A woman bleeding excessively might be considered unclean or seen as expelling too much bad blood, rather than suffering from a treatable medical condition. Constant fatigue would likely be dismissed as laziness or weakness of character, further marginalizing her suffering. Irregular periods, absence of periods, or even prolonged bleeding could also cause distress and concern. Without the concept of hormones, these variations in cycles were baffling. They might be attributed to divine displeasure, a curse, or a severe humoral imbalance. A woman experiencing amenorrhea, absence of periods, might be seen as infertile or unhealthy, leading to social stigma. Conversely, prolonged or irregular bleeding could be terrifying, especially if it was accompanied by pain or other symptoms. These conditions often went undiagnosed, with women enduring chronic discomfort and uncertainty about their reproductive health. The lack of medical insight into the complexities of the female reproductive cycle meant that what we now consider common and treatable gynecological issues were profound sources of pain, fear, and disability for women in 1185, leaving them trapped in a cycle of misunderstanding and unalleviated suffering. Number 10, the burden of the breast, unrecognized challenges of nursing. For women in 1185, breastfeeding was not just a choice, it was often the sole means of nourishing an infant. Without widespread access to safe alternatives like animal milk, which was often contaminated and difficult for infants to digest, or wet nurses for the average family, mothers were solely responsible for providing sustenance for their newborns. This made breastfeeding a vital, yet incredibly challenging, aspect of a woman's life, especially given the complete absence of medical knowledge surrounding lactation and its potential complications. The lack of understanding about breast health and infant feeding meant that many mothers and their babies suffered needlessly. Imagine a new mother, perhaps only a few days postpartum, feeling a deep, throbbing pain in her breast. It becomes red, swollen, and hot to the touch, and she might develop a high fever and chills. This is mastitis, an infection of the breast tissue, often caused by a blocked milk duct that becomes infected with bacteria. In 1185, there were no antibiotics to combat such an infection. The only treatments might involve applying hot compresses, using poultices of various herbs, or perhaps trying to express the milk, often with great pain. The infection, if left untreated, could develop into a breast abscess, a painful collection of pus that might spontaneously rupture or require crude incision, potentially leading to widespread infection and even sepsis, a deadly bloodstream infection. The severe pain and illness would make it impossible for the mother to nurse, jeopardizing her infant's survival. Many mothers would suffer silently through these debilitating infections, their bodies racked with pain and fever, often without any effective relief. Cracked or sore nipples were another common agony. Imagine the excruciating pain of a raw, bleeding nipple with every latch of a hungry infant. This could be caused by improper latch, which was poorly understood, or simply by the constant demands of nursing. These breaks in the skin were open invitations for bacteria to enter, leading to local infections that could worsen into mastitis. There were no lanolin creams or soothing balms, and the only advice might be to endure the pain or to apply strange, ineffective remedies. Many mothers would simply have to grit their teeth through the agony, knowing their infant's survival depended on it. Beyond infections, issues of milk supply were equally critical and misunderstood. A mother might struggle with insufficient milk production, perhaps due to poor nutrition, exhaustion, or genuine physiological reasons. In a world where infant formula did not exist, a baby who did not receive enough milk faced starvation. There was no understanding of how to boost supply, no lactation consultants, and the only advice might be to eat more specific foods, or to rely on traditional beliefs and superstitions about certain herbs that might increase milk. Conversely, a mother might suffer from oversupply, leading to engorgement and blocked ducts, which are intensely painful and predisposed to infection. The lack of knowledge about proper latch, feeding cues, and breast health meant that many women endured chronic pain and discomfort, their efforts to nourish their children fraught with physical challenge and anxiety, often risking their own health and well-being for the survival of their offspring. The burden of the breast in 1185 was not just about providing food. It was a constant, unrecognized struggle against infection, pain, and the overwhelming responsibility of infant survival, all without the benefit of basic medical understanding. Number 9, no escape from the ache, the absence of true pain relief. Imagine living in a world where profound pain was an everyday companion, and the concept of effective pain relief, as we know, it simply did not exist. For women in 1185, enduring chronic pain from childbirth, injuries, infections, or diseases was an inescapable reality. There were no pharmaceutical painkillers like ibuprofen, acetaminophen, or powerful opioids. Though opium was known, its use was not widespread or understood in a controlled medical context. This absence of pain management meant that women suffered relentlessly, their agony often dismissed or endured in stoic silence. Consider the pain of a broken bone, a deep wound, or a severe infection. While certain herbs like poppy, source of opium, were known, their preparation and safe dosage were rudimentary, and they were often only accessible to the very wealthy or those with specialized knowledge. Most people relied on folk remedies, often more symbolic than effective, or simply on the passage of time. Imagine a woman suffering from a chronic ailment like severe arthritis, her joints inflamed and aching with every movement. Her days would be a constant battle against physical agony, with no means to dull the sharp edges of her discomfort. She might try hot compresses, certain herbal poultices, or massages, but the fundamental pain would persist, eroding her quality of life and limiting her ability to contribute to her household or community. Childbirth, the ultimate test of a woman's endurance, was perhaps the most acute example of suffering without relief. A woman in labor would experience hours, sometimes days, of excruciating contractions, back pain, and the intense agony of pushing a baby into the world. There were no epidurals, no gas and air, no pain-reducing injections. Midwives might offer warm baths, gentle massages, or words of encouragement, but these offered minimal relief from such profound physical trauma. Women were expected to simply bear the pain, their cries often seen as a sign of weakness or, horrifyingly, as an indication of sin. This expectation of silent suffering further isolated women during their most vulnerable moments, leaving them utterly alone with their immense pain. Physical and emotional scars of such an ordeal, endured without any form of medical pain alleviation, must have been profound and long-lasting, contributing to a deep-seated fear surrounding future pregnancies. Beyond acute events, the chronic pains of daily life, from ceaseless manual labor leading to back strain, to toothaches that festered into abscesses, to the persistent ache of internal illnesses, were simply accepted. There was no understanding of nerve pain, referred pain, or the complex pathways of pain in the body. Remedies were often based on superstition or vague notions of drawing out the pain. The inability to provide any genuine comfort or relief for suffering meant that women often lived truncated lives, their activities severely limited by physical pain, their resilience constantly tested. This pervasive lack of effective pain management was a stark reality of life in 1185, ensuring that physical suffering was not just an occasional visitor, but a relentless companion for women facing the myriad health challenges of their era. Number 8, a cut or a scratch, the invisible killers from everyday wounds. In 1185, life was inherently physical and often brutal. Women engaged in demanding tasks like farming, food preparation, weaving, and animal care, all of which carried the constant risk of injury. A simple cut from a sharp tool, a scratch from a thorny bush, or a fall that broke the skin, any of these seemingly minor injuries could become a death sentence. The reason? A complete and utter lack of understanding about germs and infection. The concept of microscopic organisms causing disease was centuries away. People believed illness came from bad air, imbalances of humors, or divine displeasure, not from invisible invaders that entered the body through an open wound. Imagine a woman cutting her hand while preparing food, perhaps slicing vegetables with a simple knife. The wound is small, a mere superficial gap. She might wash it with water from the well, perhaps tie a piece of clean linen around it. But without sterile practices, that water might be contaminated, the linen might harbor bacteria, and the knife itself was certainly not sterile. Within days, the wound might begin to redden, swell, and fill with pus. This was the terrifying onset of a localized infection. Without antibiotics, the body's natural defenses were often overwhelmed. The infection could spread rapidly, forming abscesses, or worse, leading to cellulitis, a serious skin infection that spreads quickly. A more dangerous scenario was when a deep wound became infected. Think of a woman stepping on a rusty nail or experiencing a deep gash from an accident. Such injuries were perfect breeding grounds for bacteria like Clostridium tetani, the cause of tetanus. Tetanus would lead to agonizing muscle spasms, lockjaw, and eventually respiratory failure. Imagine watching a loved one's body stiffen, their jaw clench, their muscles contract uncontrollably, all while they remained conscious and terrified. There was no anti-tetanus shot, no understanding of how the disease was caused, only the horrifying symptoms and inevitable death. Beyond tetanus, general bacterial infections from wounds were rampant. Sepsis, a life-threatening complication of an infection, was a common killer. A local infection could spread into the bloodstream, causing organ failure and death. Imagine a woman with a seemingly minor leg wound that became infected, her body growing hot with fever, her mind becoming confused, her breathing rapid and shallow. Family might attribute her decline to a fever or a bad humor, never connecting it to the small injury that started it all. Without understanding the microbial cause, there was no way to prevent or treat these infections. Simple hygiene practices like washing hands before attending to a wound were not common knowledge, let alone sterilization of instruments. Every cut, scrape, or puncture was a gamble with death, a portal through which invisible killers could enter the body, ensuring that even the most minor everyday injury could become a fatal encounter in the absence of germ theory. The silent threat of infection lurked in every unsterilized tool, every patch of soil, every unwashed hand, turning the ordinary mishaps of life into potential death sentences. Number 7, hungry and weary, the scourge of malnutrition and weakness. In 1185, nutrition was not understood as a science. People ate what was available, seasonal, and affordable. For the vast majority of women, this meant a diet centered around grains, bread, porridge, some vegetables, and legumes. Meat and dairy were often scarce, especially for the poor, and fresh fruits were seasonal luxuries. This limited diet, combined with the immense physical demands of daily life and the added physiological burdens of repeated pregnancies and breastfeeding, meant that malnutrition and chronic weakness were pervasive, particularly for women. Imagine a woman who has just given birth, perhaps for the 5th time. She has been pregnant for 9 months, then spent months, even years, nursing her infant. Her body has been depleted of essential nutrients, minerals like iron, calcium, and vitamins that are vital for health. Her diet, likely insufficient to begin with, offers no replenishment. She becomes anemic from blood loss during childbirth and a lack of iron in her diet. Anemia makes her perpetually tired, dizzy, and pale. She lacks the energy to perform her daily chores, care for her children, or even properly recover from illnesses. This constant state of weakness would make her more susceptible to infections and delay her recovery from any injury or disease. There was no concept of a balanced diet, no understanding of specific vitamins or minerals, and certainly no supplements. Pregnancy and lactation were particularly draining. Pregnant women needed extra calories and nutrients, but often received no special dietary considerations. She would eat the same meager diet as everyone else. This not only affected her own health, but also the development of her unborn child, potentially leading to low birth weight and developmental issues. After childbirth, prolonged breastfeeding, often for 2 years or more, further depleted a mother's reserves. She might be living on a diet of stale bread and thin gruel, constantly feeling the gnawing hunger and physical exhaustion. Constant state of hunger and fatigue was more than just uncomfortable, it had profound health consequences. Women who were malnourished had weakened immune systems, making them far more vulnerable to every disease that swept through their communities, from influenza to tuberculosis to the plague. A simple cold could become a deadly pneumonia in a body too weak to fight it. Their bones would be brittle due to lack of calcium, making them susceptible to fracture. Their teeth would decay due to lack of vitamins, leading to painful infections. Their bodies were in a constant state of nutritional deficit, leaving them fragile and unprepared to face the challenges of life, let alone the trauma of childbirth or the onslaught of disease. This invisible enemy of malnutrition silently sapped the strength, vitality, and ultimately the life force of countless women in 1185, a widespread and debilitating condition that went entirely unrecognized and unaddressed by the limited medical knowledge of the time. Number 6. The weight of tradition, when superstition replaced science. In 1185, the lines between medicine, religion, and superstition were incredibly blurred. For many women, particularly those in rural communities without access to learned physicians, traditional beliefs, folk remedies, and spiritual explanations often took precedence over any nascent understanding of the body or disease. This reliance on tradition, often passed down through generations, meant that truly effective treatments were frequently overshadowed by practices rooted in magical thinking or ritual. Imagine a woman suffering from a severe fever, perhaps due to a serious infection. Instead of seeking a remedy that might address the underlying cause, her family might turn to a charm weaver or a village elder who advises wearing an amulet, reciting a specific prayer, or performing a ritualistic cleansing. These practices, while offering psychological comfort, did nothing to combat the bacterial infection ravaging her body. The belief that sickness was a punishment for sin, a visitation from malevolent spirits, or the result of a curse was widespread. This worldview meant that medical intervention was often seen as less important than spiritual appeasement or protection from unseen forces. Think about the widespread use of bizarre ingredients in purported remedies. Ground up animal parts, specific herbs gathered under certain moon phases, or mixtures of seemingly random substances were common. A woman suffering from infertility might be advised to consume strange concoctions, sleep with certain objects under her pillow, or visit a specific holy site. These practices were rooted in a lack of understanding of reproductive biology and were often physically or emotionally draining, offering false hope and delaying or preventing any real help. There was no concept of scientific trials or evidence-based medicine. A person recovered after a ritual, it was attributed to the ritual, even if the body's natural defenses were responsible, or if the illness was self-limiting. This reinforced the belief in the efficacy of such practices. Superstition also dictated behaviors that could actively harm health. For instance, beliefs about uncleanliness during menstruation or after childbirth sometimes led to isolation or restrictions on a woman's ability to bathe or receive fresh air, inadvertently increasing the risk of infection. The concept of evil eye or malevolent curses meant that illness was not always seen as an internal bodily issue, but as an external attack, leading to efforts to identify and counteract the supposed source of the curse, rather than treating the afflicted individual. This reliance on the supernatural meant that countless medical conditions, from infections to genetic disorders, were simply misunderstood. power of tradition, while offering a sense of order and comfort in a chaotic world, actively hindered the development and acceptance of genuine medical knowledge. Women, caught in this web of ancient beliefs, often endured suffering that could have been alleviated or prevented, all because the wisdom of the past, however unfounded, held more sway than any glimmer of emerging scientific understanding. Their suffering was seen not as a medical challenge, but as a spiritual or mystical one, leaving them without true physical relief. Number 5, the unseen enemy within, dangers lurking in uncleanliness. Imagine trying to maintain health in a world where the very air, water, and ground around you were teeming with invisible dangers. In 1185, the concept of hygiene as a preventative measure for disease simply did not exist in any widespread or scientific sense. People did not understand that tiny, unseen organisms, bacteria, viruses, and parasites caused illness. This profound lack of knowledge about sanitation and cleanliness meant that women, especially those in crowded urban centers or living in close quarters with livestock, were constantly exposed to pathogens that led to widespread illness and death. Consider the disposal of waste. Human and animal waste was often dumped directly into streets, rivers, or open pits. Water sources relied upon for drinking, cooking, and washing were frequently contaminated. A woman fetching water from a local well or river was unknowingly collecting a cocktail of bacteria and parasites that could cause dysentery, cholera-like illnesses, and other gastrointestinal diseases. Imagine the constant threat of stomach cramps, vomiting, and debilitating diarrhea, leading to severe dehydration and death, particularly in children and the elderly. Women responsible for preparing food and fetching water were frontline targets for these waterborne illnesses. Personal cleanliness was also rudimentary. Regular washing of bodies, clothes, or bedding with soap, which was expensive and often made from animal fats and lye, was not a daily practice for most. This meant that skin infections, lice, and fleas were common, contributing to discomfort and potential disease transmission. Think of the itching and irritation of lice, or the constant threat of skin lesions becoming infected due to poor hygiene. During menstruation, the lack of proper sanitary products meant that women might use reusable cloths that were difficult to clean properly, further increasing the risk of local infections and discomfort. Childbirth, as mentioned before, was a prime example of fatal uncleanliness. Without sterile instruments, clean hands, or even a basic understanding of preventing infection, the birthing environment was a high-risk zone. Midwives, though skilled in traditional birthing techniques, unknowingly carried bacteria from one birth to the next, from one patient to another. Birthing bed, often just straw or dirty linen, could be contaminated. This meant that every birth carried the risk of puerperal fever, a deadly infection caused by bacteria entering the mother's body through the birth canal. It was an invisible enemy, lurking everywhere, turning the most natural event into a perilous journey. The lack of sanitation and hygiene was a silent, pervasive killer, continuously weakening the population, especially women, who were often at the forefront of domestic duties and childcare. The invisible dangers of everyday uncleanliness meant that illness was not an occasional visitor, but a constant, looming threat, relentlessly eroding health and shortening lives in a world oblivious to the true sources of disease. Number 4, the village healer's limit, lack of professional medical training. In 1185, the medical landscape was vastly different from what we know today. There were no standardized medical schools, no rigorous licensing bodies, and no widespread scientific curriculum. For most people, especially women outside of wealthy urban centers, medical care came from local healers, the village elder, the wise woman, the midwife, or perhaps a monastic practitioner. While these individuals often possessed valuable empirical knowledge passed down through generations, their understanding was limited by a complete absence of scientific training, anatomy, physiology, or germ theory. This meant that their interventions, though well-intentioned, were often ineffective and sometimes dangerous. Imagine a woman suffering from a complex medical issue, perhaps a difficult childbirth, a chronic internal disease, or a severe infection. The local healer might have learned their craft through apprenticeship, observation, and inherited family lore. They might know certain herbs for pain relief or fever, how to set a basic fracture, or how to assist in a normal delivery. Their knowledge was rarely systemic or based on scientific principles. They had no understanding of internal organ function, no concept of sterile surgical techniques, and no diagnostic tools beyond observation and simple palpation. Broken bone might be splinted, but without proper setting, it could heal incorrectly, leading to lifelong disability. For women, this lack of specialized training was particularly critical during childbirth. Midwives, while central to the birthing process, operated solely on experience and traditional wisdom. Complication arose, a breech presentation, a prolonged labor, or a severe hemorrhage. They had no surgical skills, no understanding of how to use instruments, and no way to intervene effectively. Their only recourse was often to let nature take its course, or to offer desperate prayers, watching helplessly as mother or child, or both, succumbed. The midwife's knot was a horrifying reality, where a woman's knowledge was limited to normal deliveries, and any deviation meant disaster. Male physicians, often trained in universities, though these were few and their curricula still steeped in ancient texts and humoral theory, were rare and primarily served the elite. Even then, many male doctors were reluctant to examine female patients intimately due to societal modesty norms, relying instead on urine analysis or descriptions of symptoms from a third party. This meant that gynecological issues, breast problems, or even conditions exacerbated by pregnancy were often diagnosed inaccurately or missed entirely because direct examination was avoided. A woman might be suffering from a breast tumor, but a male physician might never feel it, relying on second-hand information, leading to devastating delays in any potential intervention. The consequence was that women, facing immense health challenges unique to their biology, were largely reliant on a system of care that lacked foundational medical understanding. The knowledge of the village healer, while invaluable for basic ailments and comfort, was profoundly limited when confronted with life-threatening conditions. This systemic absence of professional, scientifically grounded medical training meant that women lived in a state of constant vulnerability, their lives and health dependent on traditional practices that often offered little defense against the true forces of disease and bodily failure. Number 3, the peril of childbed fever, a silent killer after birth. Imagine the immense relief and exhaustion of a woman who has just brought new life into the world in 1185. The arduous journey of childbirth is over, and a tiny, fragile baby rests in her arms. Countless women, this moment of triumph was swiftly followed by a terrifying and often fatal illness, childbed fever, also known as puerperal fever. This insidious killer was entirely unknown in its cause and mechanism, and it silently ravaged communities, claiming mothers shortly after their delivery. The root of childbed fever was, unknowingly to people in 1185, bacterial infection. During the intense process of childbirth, the mother's body sustains tears and abrasions, especially in the birth canal and uterus. In a world without sterile practices, these wounds were wide open portals for bacteria to enter the bloodstream. Midwives, though skilled in traditional birthing, often unknowingly carried bacteria on their unwashed hands from one delivery to the next, or from other sick patients. Birthing environment itself, the bed, the room, the instruments, if any were used, was rarely clean in a modern sense. A midwife might assist a woman through a difficult birth, her hands touching potentially contaminated surfaces, then attend to the next woman, inadvertently transferring deadly pathogens. Imagine a new mother, perhaps only a day or two after birth, developing a high fever, chills, and severe abdominal pain. Her body aches and she feels profoundly weak. These were the telltale signs of puerperal sepsis. Bacteria, once inside her uterus, would rapidly multiply, causing a severe infection that could quickly spread throughout her bloodstream. Without antibiotics or even basic antiseptic washes, there was no way to stop the infection's relentless progression. Her body would become overwhelmed, her organs starting to fail. The despair of families witnessing this was immense. They had celebrated a new life, only to see the mother succumb to a mysterious fever within days. Healers might try herbal concoctions, prayers, or attempts to balance humors, but these were futile against a systemic bacterial infection. The woman would grow weaker, her breathing would become labored, and eventually she would die, leaving behind a newborn baby and often other young children who would now be motherless. The emotional toll on families and communities was devastating, as this unseen enemy preyed on women at their most vulnerable. Childbed fever was a leading cause of maternal mortality in 1185 and for centuries thereafter. It was a stark reminder of the profound dangers posed by a lack of understanding of germ theory and basic sanitation. The joyous event of childbirth was tragically intertwined with the very real risk of a swift and agonizing death, a silent epidemic that swept through birthing chambers, taking lives and shattering families, all because the invisible threat of bacteria was completely unknown. The mothers of 1185 lived with this ever-present shadow, a stark demonstration of how medical ignorance could turn the miracle of life into an unexpected passage to death. Number 2, the unstoppable flow, when blood betrayed a birthing mother. Beyond infection, one of the most terrifying and common killers of women during or immediately after childbirth in 1185 was hemorrhage. Imagine a woman, having just endured the agony of labor, suddenly feeling a catastrophic rush of blood. In a world without blood transfusions, intravenous fluids, or effective medications to control bleeding, a severe postpartum hemorrhage was almost always a death sentence. There was no medical understanding of the uterus's need to contract after birth to close off blood vessels, nor any way to rapidly replace lost blood. The primary cause of postpartum hemorrhage is often uterine atony, where the uterus fails to contract sufficiently after the baby is born, leaving myriad blood vessels open and bleeding freely. In 1185, a midwife might know to massage the belly to encourage contractions, a technique that sometimes helped. But if the uterus remained soft and boggy, the bleeding would continue unabated. Imagine the scene: a woman already exhausted, suddenly losing vital blood at an alarming rate. Her bed, her clothes, the floor, all quickly soaked crimson. She would grow pale, dizzy, and weak. Her pulse would become thready and rapid, her skin cold and clammy. Other causes of hemorrhage, like retained placental fragments or severe tears in the birth canal, were also incredibly dangerous. A piece of the placenta remained inside the uterus. It would prevent the uterus from contracting fully, leading to continuous bleeding. Midwives might manually attempt to remove the placenta, but without a complete understanding of anatomy or sterile procedures, this could cause further trauma or introduce infection. Tears in the vaginal wall or cervix during a difficult delivery, if severe, would also bleed profusely. There was no ability to suture these tears effectively, especially deep ones, meaning the bleeding would continue unchecked. The consequences were swift and brutal. A woman could bleed out within minutes or hours. Her body, already depleted by pregnancy and labor, had no reserves. There was no concept of fluid resuscitation to combat shock, no way to give her new blood. Her life force literally drained away before the eyes of her family and the helpless midwife. Only treatments might involve applying cold compresses to the belly to try to encourage contractions, or various herbal preparations believed to stop bleeding, but none of these could counter a catastrophic loss of blood. The sheer helplessness in the face of such a medical emergency was immense. The mother, having just endured the miracle of birth, was now rapidly dying, her life slipping away with each gush of blood. For women in 1185, postpartum hemorrhage was a terrifying, unpredictable threat, a clear demonstration of how a lack of physiological understanding and emergency medical intervention could turn the joyous outcome of childbirth into a devastating and often swift loss of life. It was a grim reality that underscored the perilous nature of motherhood, a betrayal of the body at its most vulnerable moment, with no way to staunch the unstoppable flow of life. Number 1, the ultimate test: childbirth without knowledge or care. For women in 1185, childbirth was not merely a life event. It was often the ultimate test of survival, a journey into the unknown where the odds were stacked against them. Without any of the medical advancements we take for granted today, bringing a child into the world was fraught with terrifying risks that went far beyond what most can imagine. It was a perilous journey, often undertaken without proper medical knowledge, skilled intervention, or hygienic conditions, leaving countless women to face agony, injury, and death. Imagine a young woman, perhaps 16 or 17, entering labor for the first time. She might have been married for only a year, with little understanding of what her body was about to endure. There were no prenatal classes, no detailed explanations from doctors. The only guide was the traditional wisdom of her mother and the village midwife. The labor was long and agonizing, lasting for days. There was no way to assess the baby's position, size, or distress. A midwife might try to turn a breech baby feet first or a transverse baby sideways, but these maneuvers were often crude, causing internal injuries to both mother and child and often failing completely. The concept of a cesarean section, though known from ancient texts, was almost universally fatal for the mother in 1185, typically only performed post-mortem to save the infant. Therefore, if a baby could not pass through the birth canal, both mother and child would perish. Prolonged or obstructed labor was a death sentence. Without instruments like forceps or vacuum extractors, or the ability to perform a C-section, a mother simply continued to push until she was completely exhausted, or until her uterus ruptured, a catastrophic event leading to immediate and agonizing death. If the baby was too large, or if the mother's pelvis was too narrow, there was nothing to be done. Both would die from exhaustion, infection, or internal trauma. Imagine the profound terror of a woman trapped in endless labor, her body failing, her cries unheard by any truly effective intervention. Even if the birth was successful, the risks did not end there. Severe perineal tears, extending from the vagina to the rectum, were common, especially in first-time mothers. These could cause lifelong pain, incontinence, and chronic infections. Without surgical repair, these injuries often healed poorly, leaving women with debilitating conditions that affected their dignity and quality of life. The knowledge of how to properly diagnose and suture such tears simply did not exist. The birthing process itself, often taking place in unhygienic conditions, paved the way for the deadly childbed fever, as detailed in Chapter 3, and postpartum hemorrhage, as explained in Chapter 2. The entire experience of childbirth in 1185 was a grim testament to the profound limitations of medical knowledge. It was a time when maternal mortality was incredibly high, and infant mortality even higher. Every pregnancy, every labor was a roll of the dice, with a woman's life hanging in the balance, utterly reliant on the resilience of her own body and the limited, traditional wisdom of those around her. There was no scientific understanding of the mechanics of birth, no pain relief, no antibiotics, no surgical interventions, and no blood transfusions. For women, this meant that the act of bringing life into the world was one of the most dangerous endeavors they would ever face, a stark and brutal reminder of how desperately needed future medical advancements truly were.